It's a mystery that gets more and more complicated. The loss of smell and taste from COVID-19. Now medical professionals are trying to figure out why some people of all ages and levels of illness are getting their senses back, but not in the way they once knew.
Like I can't drink soda, right? So like I'll try to hold my breath to see if I can just drink it. For me, sodas taste like when you bite on a battery, it feels like a metally taste.
Newark resident Diane Marcillo got COVID in October of 2020. She says she lost her taste and smell, but fully recovered about 2 weeks later. Then in January, about 2 months later, she noticed her tastes and smells were all of a sudden distorted.
That's why it caught me off guard.
Any meat she has, she says, even if it's well cooked, tastes raw and smells rotten. She also has experienced severe reactions to onions.
It's like sour smell. It will give me migraines. It will literally push me to bed and I would have to like cover my eyes.
Marcillo says with time, more and more items are being added to her do not eat list.
It's garlic, it's bananas, it's berries, broccoli, it's potatoes. They taste like it's rotten basically. And let's say they put some garlic on the pasta. If I eat it, I end up getting stomach pains that puts me to bed. Like I can't get up. Like they're a severe cramp.
Many of the 28,000 members of a Facebook group called COVID-19 Smell and Taste Loss describe similar food distortions. Anything cherry smells like the inside of a pumpkin. Everything started smelling like chemicals.
I have had one patient who had olfactory hallucinations, meaning they were not real. She smells smoke, but there's nothing on fire and there's nothing burning.
Medical Director Dr. Vanessa Tres-Palacios and nurse navigator Christina Davis are working to help patients with these symptoms at the post-COVID care program at St. Barnabas Medical Center. RWJ Barnabas is an underwriter of NJ Spotlight News. About 40 of the 165 patients currently in the program have reported distorted smell and taste, but they suspect there are many more suffering with this side effect that have not sought care.
Depending on what complaints they have, then we refer them to either a neuropsychologist for sensory rehab, retraining, or ENT for aromatherapy, for different kinds of assessments to see if it's really an issue in the sinuses or is it an issue with nerves. And then we can almost even send people to neurology to see if it's actually an issue with the brain and how the brain's functioning.
No trends you're noticing in terms of the people who are experiencing this?
So we have a couple of research studies in place. We're collecting the data now.
Very likely that patients that will have post-COVID syndrome are those that initially exhibit 4 or more symptoms when they're sick with COVID. The other pattern that we've noticed is that, again, regardless of the symptoms, if you push too hard, then you regress.
As for what's causing these long-term side effects, that's also being studied.
Well, without looking at like true evidence-based data, potentially could be like inflammatory cells that are just interfering with nerves and neurons in the brain, or whether it's the olfactory nerves in the nose or in the sinuses. That's why we have physicians and ENTs that are currently looking at all this stuff right now.
I've lost 15 pounds from this because there's days that I don't eat.
Marcillo says she's discouraged to eat anything because she doesn't know how she'll react.
I do try to like pick on little things to see if I'm getting better. And because I no longer have that horrendous smell for certain food, it's just a tiny bite out of it. And when I say tiny bite, I still get sick. It's taking its slow mark. I don't know when I'll get better.
We've seen few patients that have come in the very beginning who've had some large complaints of loss of taste and smell, altered taste and smell. They come back for the 3-month or 6-month appointment saying that I'm 50% better, or I'm 80% better. And for them, that's a huge hurdle.
A hurdle Diane Marcillo hopes to achieve sooner than later. I'm Leah Mishkin for NJ Spotlight News.